All right, so yeah, good evening, everyone. Thank you so much for joining this webinar. Really appreciate people taking time out of their evenings to attend. This evening's session is going to be focused on trigeminal neuralgia and medical cannabis. We've got a great lineup of speakers that will be able to cover all bases of receiving the most up-to-date information in terms of evidence, patient experience, and how you can receive a prescription for medical cannabis in the UK. A really quick intro from me. My name is Katya Kowalski, and I'm head of operations at Volteface. We're an advocacy and communications organization that works in the UK medical cannabis sector. We're also the co-secretariat for the all-party parliamentary group for medical cannabis under prescription, quite a mouthful. And we also manage one of the most read online platforms about medical cannabis in the UK. If you didn't know, medical cannabis has been legal in the UK since 2018 for a wide variety of conditions, all prescribed by specialist clinicians. And trigeminal neuralgia is one of the conditions it can be prescribed for. There's currently over 35,000 patients in the UK accessing medical cannabis for a wide variety of conditions. So this evening, we're going to discuss trends around medical cannabis prescriptions in the UK, evidence around the use of medical cannabis for TN, clinical perspectives and experiences, patient experiences, and routes to access for patients, along with much more, I'm sure. So without further ado, I'm going to introduce all of our speakers for the evening and then pass over to our first speaker. So first speaker is Aneeta Prem. She is the CEO of the Trigeminal Neuralgia Association. Aneeta's personal struggle with bilateral TN and an unsuccessful microvascular decompression surgery deeply has informed her advocacy and leadership. Aneeta's implemented crucial initiatives, and her efforts have led to a doubling of the TNA's membership and launching innovative fundraising campaigns, which have significantly bolstered the charity's financial health and expanded support across the UK. Our second speaker is Teri Miller, who is a trigeminal neuralgia patient. She has had microvascular decompressions, one successful for 2 years and a second that was unsuccessful, with major reactions and no benefit with medications. And since this, Teri has moved on to a medical cannabis prescription and treatment, which has helped her live with this condition. We'll then hear from Dr. George Eralil, who is a consultant neurosurgeon. And consequent to his facial pain, interest, and experience, he currently performs the majority of surgical procedures for trigeminal neuralgia in Wales. He also recognizes that TN is unlike other chronic pain conditions, and there's a complex interplay between electrical activity that goes through the trigeminal nerve and how one's brain perceives that information. And he's recently had firsthand accounts of some of his long-term patients who have benefited from medicinal cannabis. And this particular phenomenon, coupled with the fact that there are very few effective treatments for this pain, has led to Mr. Eralil's interest in the human endocannabinoid system and the effect that medical cannabis can have on such relentless pain. So he's currently a prescriber of medical cannabis for neurosurgical conditions in his professional remit, which TN falls under this. And finally, Hannah Simon from Scriptassist is going to be presenting. Hannah is COO of Scriptassist, first and only platform that enables patients to connect with independent specialist doctors who are educated and experienced in medical cannabis to treat their specific condition. Hannah has been involved in the UK medical cannabis space since its inception in 2018, and she's previously worked in UK healthcare as a management consultant. So yeah, those are all the panelists. They're right in front of you. We'll use any time after all the speaker presentations for some Q&A. So throughout the webinar, please use the Q&A function. If there's a question you'd like to ask one of the panelists, I just mention who it's addressed to, and I'll do my best for as many questions to be answered at the end of the session. We're also recording the session, so it'll be available on our YouTube channel to watch after for other patients that might find it useful. So feel free to share it. So yeah, without further ado, I'd like to welcome our first speaker for the evening, Aneeta, who's going to give an overview of her work at the TNA and discuss what sort of queries patients have around medical cannabis and yeah, the general unmet need around TN. So yeah, I'll pass over to you, Aneeta.
Hi, good evening. Welcome, everyone. Thank you very much for inviting me to talk about this, and I can see some old friends on the webinar, so lovely to see you. So trigeminal neuralgia is recognised as the most painful condition that medical professionals often ever have to treat. And many GPs, they may never see a patient with trigeminal neuralgia, and often they get the diagnosis wrong. So if you're fortunate enough to be sent to a neurologist who can diagnose you, hopefully you have an MRI scan, and then you're diagnosed, and then you're on the journey of various medications. And for many patients, members of the trigeminal neuralgia family, and we've got over 2,000 people that subscribe to our membership. One of the really sad things is for them, they get to a stage where the medication stops working, or the side effects of the medication are so severe that they feel they can no longer take them or live any kind of normal life. And people with TN, apart from experiencing the most excruciating pain on their trigeminal nerve, and that's your trigeminal nerve, the main thing that they're experiencing, apart from, it's almost becoming like post-traumatic stress disorder. You don't know when you're going to be attacked with sharp pain. It can feel like electric shocks. It can feel like someone's stabbing you. I've got a pencil here to demonstrate, you know, and it can go into various areas, in towards your eye, which is V1, V2, which are often going to stop you brushing your teeth or eating, and V3, where I experience the majority of my pain. And when people are having these attacks, the majority of people we speak to are unable to speak, unable to function, and unfortunately, many people are unable to work. One of the things that we're witnessing in, you know, and I became the CEO during COVID, was the extreme loneliness that people with TN have, because they stop working, they're unable to, their families can't deal with them any longer because of the pain they're in. You know, people are often affected by many triggers. It can be the air, it can be wind outside. So you find yourself not going out anymore and not doing the normal things in life that you should be doing. And I can see Teri's agreeing with me. And it is a disability, and it's an invisible disability, and it's not really recognised very well. And there isn't really much help. So if there is something that can help our members and people in the TN community that have this condition, if it can ease their pain in any way, we have to support something that can help people. We have no option. I also am a magistrate, and so I'm sitting with two hats that maybe seem conflicting, but they're not. When we're talking about medical cannabis, we're talking about a natural remedy that can alleviate pain for thousands and thousands of people, maybe millions of people worldwide, with different types of pain, certainly neurological pain. And we need to promote active research into this so it can be recognised as a treatment, not only in the private sector, but on the NHS as well. And when we ever talk about, we do a webinar once every 2 months, and on average there's about 300 people that attend. I can tell you, if I was to advertise anything on medical cannabis, that would double. Everybody is incredibly interested in trying a natural remedy that could alleviate the pain. When I first became the CEO, a member contacted me. She was in her 80s. And she had told me that she was taking cannabis, street cannabis. I assume it was cannabis and not skunk. And, you know, there was various things that people buy on the street. So I'm assuming it was cannabis. And then she was very distressed to say that while she was collecting her pension, after she collected her pension, she paid her street dealer for this cannabis. He mugged her. So he didn't only just take her pension, he didn't give her that. And he said, if you report me, I'm going to tell everyone you're smoking weed. And she really didn't know what to do. She didn't want to report it. She knew who the person was. And she felt like she was a criminal for taking something that she needed to alleviate her pain, and didn't know where to go. Well, I had no qualms about reporting the dealer whatsoever, and ensured there were some safety precautions put in place for her. But if you just think about, you know, it could be someone's grandmother or mother we're talking about, that's in such extreme pain that will go into the street to buy this. And there are legitimate ways that you can get medical cannabis, and you've got amazing experts like George that will, you know, really make sure that this is the right treatment for people. And I've spoken to various people that have been on various forms of medical cannabis, be it the drops or vaping it or various other ways. And not only, mainly overseas in America and Canada, and they are talking about how much it is alleviating their pain and they're not having the horrendous side effects. And I think that's something we really need to focus on. If someone's fortunate enough to have MVD surgery or a few other treatments that are available and it's successful, fantastic. It's brilliant. But if that doesn't work for you, or you can't have those treatments, then having something that can actually give you back your quality of life is crucially important. It's almost a campaign, I'd like to say. It's like, make plants legal. You know, we're not advocating people taking drugs. We're advocating people taking a treatment that can make a difference. And part of me wishes it wasn't called cannabis, you know, that it had a different name, because actually there wouldn't be this stigma and we'd all be able to receive it far more easily. But I'm an advocate that anything that can help, and we have spoken to I've spoken to dozens and dozens of people that tell me how much it has helped them.
Are you is that your sign that you're finished with your with your speech? I didn't want to interrupt anymore. I mean, that is like, it's absolutely fascinating. I think it's especially fascinating that there's such an interest and uptake amongst the trigeminal neuralgia community around medical cannabis, because I think there's, for other condition areas, there's still like so much stigma and resistance. And I guess that's, you know, a combination of how severe the symptoms are and the fact that nothing else works, that yeah, we're seeing such an interest in uptake around medical cannabis. But yeah, as you've mentioned, there's still like so much that needs to happen for, you know, patients to be able to access it and to feel comfortable disclosing their use of it, and to be able to do it in a legal way.
And feel safe
Um,
and don't and not embarrassed about taking this. You know, I mean, it's something that will help people if it works for them, and it's just another piece of our toolkit that may just help when you're at the end and there's nothing else helping you. I mean, you know, I hate the term suicide disease when we talk about trigeminal neuralgia, but we've had to use the Samaritans as a third option on our helpline. Now, we introduced a free phone helpline in the UK for everyone with TM or facial pain to use. And I had to introduce the Samaritans as one of the options where many of our members, many people we speak to, are talking about taking their own lives. They've got the exit strategy, whether they're collecting loads of tablets or they've made decisions on what they're going to do. And I don't think we can, you know, say how much people are in pain and how they so desperately need any kind of help. And it's not clutching at straws, because we know for many people it works.
Yeah, 100%. Well, I mean, I think this is a really nice segue into Teri's talk and contribution. Is I think yeah, well, from my chat with you last week, Teri, I think there's a lot in common around what Aneeta's raised. So yeah, I'll pass over to you now if you want to chat through your patient journey with TN and yeah, what your experience with medical cannabis has been like.
Okay. I am a little bit emotional from that. It's been a long journey. I was diagnosed back in 2015. That took a long time to get a diagnosis. I then had my first MVD back in 2018, which was successful. I had 2 years, and this man George is a miracle worker. The 2 years I had was just my life given back to me. Unfortunately, for whatever reason, my body decided that I needed to have it back. And again, I think it was about 2017, 2018 that I started having sort of niggles, and I was like, no, this isn't real. It's just my brain telling me that it's this, but it isn't. Unfortunately, I had then a second operation in 2022. George, you know, obviously told me all the pros, cons, other things we could look at. You know, we worked really hard together for a lot of things. Unfortunately, that operation wasn't successful, and I still live with TN on the right side. And I was actually talking to Katya the other day, and I'd had a major flare-up over the last couple of days, and my husband despairs with me being such a prude, I suppose, around cannabis still, even though it works for me. I don't like vaping. I just don't. I don't like smoking the stuff. I know it's not vaping it. But within an hour of me just 3 puffs, I could talk, I could eat. I had a conversation with Katya, and it was like, hang on a minute, light bulb moment. Why on earth am I putting myself through this? I am someone that has never as a teenager smoked, did drugs, never took anything. So for me, cannabis was a lot of conflicting things for me. I felt embarrassed about it. Telling my family was like, oh, you know, but this is helping me. And they were all like, are you crazy? My dad was like, well, I used to smoke it as a kid. And I'm like, don't, you know, and they laugh and they giggle at me, but I still do have real anxiety around using it. Give me a white pill of paracetamol, more than happy to pop that. So what's the difference? You know, what is the real difference? There isn't a difference. It's medicine that's working. I sleep through the night. That is priceless, absolutely priceless, because I was going insane. I was on morphine, which is not a prescription for trigeminal neuralgia. I was taking cocodamol. I was taking multiple other prescribed trigeminal neuralgia medications. Nothing worked. You know, it worked for a period, and then I'd lose my words. I'd forget things. I'd come out in hives. One sent me to the hospital because it made my heart go funny. Not quite sure what happened, but yeah, I was rushed into hospital with that one, and they were like, come off it. Yeah, unfortunately, you know, none of the medications worked. And I was breaking. I was probably emailing my wonderful consultant once a week going, help, please, I'm going mad. I can't work, I can't drive. I've worked since I was 16 years old. I've never not worked, and now I do Amazon deliveries, but that it's completely flexible. So I do it when I can. So it works for me. Sorry, I know that's off topic, but for me, it's a big thing to be able to do something. Yeah, it's, you know, I take the daytime oil, and that just gives you, it just takes the edge off things, you know, it just stops me from clenching everything, from tightening everything. When the pain is there, it just numbs it down. It doesn't take it away for me, but it just stops you going, this hurts. And like I said, the nighttime stuff is invaluable, and now I'm getting my head around the vape. That's great too, because it's an instant relief. It's an instant stops your body from clenching, tightening, locking, because my jaw locks. So yeah, that's me.
Well, thank you so much for sharing that. I can completely understand how emotional and difficult
Yeah.
it is to kind of to I feel like talking about yourself at the best of times is a challenge, and opening up about such personal pain, and just I can't even imagine what you've gone through. But it's so amazing to hear how beneficial the products that you've used have been, and and like I think anyone would be silly to think that this isn't medicine and that it doesn't have potential when you hear stories like this.
I mean, to
So
be
yeah,
able to have it. Sorry. So the other thing is, like, obviously, to be able to get it prescribed is fantastic, because I've got the team there that support me. They check in, you know, there's regular checkups to make sure I'm okay, to make sure that the dosages are right. They, you know, obviously, but for me, it's a major financial difficulty privately. You know, it just is. And I can't imagine, you know, like I said, pensioners going down the street, you know, that's disgusting. That's appalling. It should be available through the NHS. And now I'm going to stop.
no, you're more than welcome to keep talking. And to the participants, the attendees in the audience, if there's anything you'd like to ask Teri, anything that you're curious to know about, you know, how the medication works, or any more specific questions, do just pop them in the Q&A, and we'll try and get to them at the end of the session. But I'll pass over to you, George, now. You should have screen sharing abilities. I've given you host permissions. So yeah, amazing, cool.
Hi everyone. I take it you can see my screen that says, "Can I weed out my lightning?"
Yeah.
Yes.
Okay. Hi Aneeta. It's been a while since we've met, and thank you, Teri, for coming on this as well. So it's been incredibly challenging to put together a set of slides that narrows down a topic that is so broad. You know, the burden of, well, I'll start with chronic pain. The burden of chronic pain in the United Kingdom is about 28 million adults, and 35,000 of them are known to cannabis clinics across the country. So that's just a tiny fraction. How do you then introduce the subject of medicinal cannabis to an even rarer population that has fairly intractable trigeminal neuralgia, because it's 3 to 5 people in 100,000 who will get the disease in the first place. So it's so I do appreciate everyone who's actually attending today. So these are things that you already know. TN is a very rare condition. Its expertise is hard to find. It's hidden away in specialist centers. The rare condition also has so many mimics. And then when these mimics are then filtered down to TN, there are also so many treatment options. So, a lot of these treatment options can be effective for the pain, but there may be very annoying side effects. But more importantly, sometimes the price you pay for those interventions or treatment choices, as they call it, is massive. It could mean, not having a family. It could mean not going to work. It could mean a lot of things. So I had to put this in because Aneeta has written a book before, and whilst this is not about TN, I think the title is actually apt. It isn't fair. And why isn't it fair? It's only because there were many options to treat trigeminal neuralgia without much guidance in the past. I mean, that's all changed. Um, the phenomenon of if the only tool you have is a hammer, you see every problem as a nail. So the push is to try and educate a number of people or several people that there are actually different options, and you'll need to see somebody who can actually give you the various options in an unbiased fashion. So just a sample of the different kind of treatments that you may have undergone in the past: drugs, neuromodulation techniques. There are and all the way leading up to microvascular decompression. A lot of these are nerve modulating and non-invasive techniques, and then there are some nerve destroying techniques which basically make microvascular decompression quite ineffective or less effective in the long term. And this is the phenomenon. So it's just so many different options, but ultimately every option has a goal, and in respect of who's treating you, and what kind of common specialties they might have, everyone has one common aim, and that is to get you better. So this brings me to what actually happens in trigeminal neuralgia. Well, this is a guy called Paul Hudson. He used to be lead singer of a group called HR, and he had trigeminal neuralgia, and he actually has an album called Bad Brains. And to a certain extent, it is true. Because why do you get the pain in trigeminal neuralgia? Well, this picture shows you the actual nerve itself, and you see a tiny little part of that nerve which subserves some muscles of chewing and things like that. But the majority of the nerve is sensory. So all of the sensations that go from one side of your face to the brain goes through that nerve. So it's effectively a window to the outside world. And it's this electrical phenomenon where each of these individual cables, or some of these lose their insulation, and there's a bit of a short circuit that goes on. So that effectively, coupled with the pulsation of a blood vessel, can lead to the short circuit. So why is it felt as pain? Well, the problem is with perception, you see. The brain is the ultimate organ that decides whether this is a pleasant sensation or not. Now, we have many different sensations and receptors for those sensations in our face. Sensations that can take away, the cold, light touch, the heat or warmth or pain or pressure. But each of these sensations tries to travel through the nerve. But when they come to a point where the nerve itself is compromised, there's a massive short circuit that happens, and a huge impulse gets into your brain, which can only be interpreted as pain. So there's research, or there's enough evidence to show that there is actually a problem inside your trigeminal nerve. So and some of you may agree and will agree, Susan, Teri included, that there is a reason that trigeminal neuralgia can come back. It's not the blood vessel that slips back in place. It is the actual problem with the nerve itself. So there's all of these treatments that people go through. Each one has its role. So where does cannabis come in? Well, we have we produce cannabis ourselves. We have an endocannabinoid system within our human bodies. But why do we have one? Well, millions of years of evolution and the actual cannabis herb being ingested by millions of ancestors, naturally made a human endocannabinoid system. And this was officially discovered in the 1980s, but really it is not yet taught in medical school. I didn't learn that we had an endocannabinoid system within our own human bodies. So we produce natural cannabinoids, and these are actually produced on demand. Two of the most famous ones are 2-AG and something called anandamide. Now, ananda in Sanskrit means joy, and that's where the term comes from. What does it do? Well, the way that nerve fibers conduct electricity is through chemical reactions, and there's a little junction between neurons that then rely on certain neurotransmitters being secreted. So what do cannabinoids do? Well, they're like a mop. They are produced on demand when there's so much excitatory material there that they just mop them all up or send them to another place that then calms the nervous system down. So that is the role. The problem with the cannabinoid system is that it is multifunctional. There are so many organ systems that it affects, so you can't really measure it that much. So it's important for energy, metabolism. It has effect on fat cells, liver cells, muscles, every single organ system in the human body, bar maybe the nails or the hair. It affects motor control, spasticity, bladder function. But those are our cannabinoids. Now, the cannabis plant is something that produces these cannabinoids, and they are called phytocannabinoids. Now, the only addition that they have is the THC component, which humans don't really produce. So that's why you hear terms like THC and CBD, and it's the THC that causes the high, and the CBD that actually causes the pain relief. But they all have very good medicinal effects, and both of them can counter the effects of one another if one is in excess. In fact, THC is a very potent anti-inflammatory agent, about 20 times more potent than aspirin, or even twice those of the kind of steroids that we give. So there are several effects. And the issue is that when you start getting cannabinoids from plants, it's a herb. There are many other substances that it is related to. So there are at least 147, 150 different cannabinoids. They all go by different names. And then there are terpenes, which are the which are the chemicals that give the texture and the flavor and the medicinal properties. Things like myrcene, which is very earthly and aromatic, linalool, which is more floral and flowery, limonene, which is more lemon-like, and pinene, which has a smell of pine. Caryophyllene is pepper, for example. So many different properties of these terpenes, and these terpenes are a strange bunch, because the moment you burn or heat the flower of cannabis, these terpenes just disappear. So in order to achieve the medicinal properties, you need some, or if you, for example, subject cannabis flower to X-rays, they disappear. And then to complicate things, there's cannabis sativa, there's cannabis indica, there are other, what they call ruderals, which are the crossbreeds and the hybrids. So how does that fit in with trigeminal neuralgia? Well, what is TN pain? It is an electrical phenomenon. It's not pain where you've actually injured your hand, or when you fix it, the pain's gone. This is an electrical short circuit. It's like seizures or epilepsy, and that is why anti-seizure medications such as carbamazepine and oxcarbazepine and gabapentin work. But the price you pay is the side effects of such medications. Is it chronic pain like back pain and neck pain, where there is no injury? And probably not. And that's probably the reason why other painkillers such as ibuprofen and, morphine and other opioids don't really work. So where is the science behind it? Well, there's a big difference between science and evidence. And this is the difficulty with medicinal cannabis in anywhere in the world. So there is very good science to back the use of medicinal cannabis. It's not within the scope of my presentation, because that would take another presentation and a half. Trigeminal neuralgia is unique, so we're trying to pitch this to a rare condition and a much smaller population. Is there evidence to prove that it is effective? Well, not really. There are many publications, but then none of these are what we call class 1 evidence, which modern medicine relies on. And that is the biggest problem. Because let's say you take a pill to reduce your blood pressure. It is one drug that acts on one receptor to reduce your blood pressure. So it's measurable and it's reproducible. How do you test medicinal cannabis when it has so many variables? You cannot. And what are these variables? Well, it has too many cannabinoids. It has too many terpenes. It has effects on various organ systems, not just one. The temperature that you grow it in, the humidity that you grow the plant in has an effect on the kind of terpenes you get out of it. The extraction process, whether it's heat-based or carbon dioxide-based, will cause you a problem. Whether the individual taking the medicinal cannabis has, at what level is their endocannabinoid system able to respond? And of course, the intake of the flower itself, is it an oil? Is it a vape? Is it a pill? So there are several practicalities, and for example, the United Kingdom law states that so medicinal cannabis has been legal in the UK since 2018 November, so it's a good 6 years now, or 5.5 years. But you can't combust it. So smoking cannabis is illegal in the United Kingdom. However, vaping is completely legal because you can temperature control it. The DVLA can stop you, for example, if they find that you have any amount of THC in your system. But with a medical prescription, you could actually justify why. But then the DVLA also says that you must not drive if you feel like you can't. So if you're tired, just don't drive. If you have too much THC in your system, just don't get out. So then again, it relies on the individual, themselves. Who can prescribe cannabis? Well, the UK law is very specific on that too. It's, it has to be a medical professional on the specialist register of the General Medical Council. So that excludes general practitioners, which is a travesty. General practitioners should be able to obtain the training and be able to prescribe medicinal cannabis. However, general practice is associated with the National Health Service. And cannabis is not available on the National Health Service. There are so many lobbies pushing towards this, but really, there's only 2 preparations within the NHS that are actually approved, and they have very specific indications, and pain is not one of them. You have, do you choose a CBD-rich preparation? Do you choose a THC preparation? Do you choose a radiated flower? Do you choose an irradiated flower? Do you need pain relief during the daytime, some relaxation during the during sunset, and then to induce some sleep at night? Because you're absolutely right, Terry. Sleep has a lot to do with the brain's recovery system. You need 8 hours of sleep for the brain to recover all these repair processes. And if you don't allow for that, you're in this really vicious circle. Who can obtain prescriptions? Well, any member of the general public can obtain a cannabis prescription, provided they satisfy a few criteria. Number one, that they should have gone through at least 2 standard prescribed treatments for their particular condition. Now, for trigeminal neuralgia, they can be many, but none of them may be effective, or you have a lot of side effects, or maybe you are waiting for your definitive intervention, and the UK law allows for that. So if you're waiting for something to happen, and as an interim, you can obtain a prescription for medicinal cannabis. How is it regulated? Well, it is regulated very, very well. In fact, it is one of the most regulated industries in the United Kingdom. You have to approach a medicinal cannabis clinic or a platform. You have to obtain GP records. You have to prove who you are, and you have to go through your own due diligence and questionnaires before you're even able to see somebody who will be able to go through your story. Does it have to be through a clinic? Well, there are several clinics in the United Kingdom, but simply not enough. Are there independent platforms? Well, Script Assist has just started a platform, and it's one way of getting around the going and registering to a clinic. It's much more helpful to a clinician that way. And of course, it's not available on the NHS. The biggest barrier, however, is the adoption of it. How do you go to a General Medical Council certified doctor and say, and just tell them, well, you know what, cannabis is great. Medicinal cannabis is even better. It's, and as Aneeta said, it is the stigma attached to that word. I wish it wasn't called cannabis. It's very simple. It should have been called something else, and we can't invent another term. But it is a fantastic herb. It has so many uses, and TN is becoming one of them.
Thank you so much for your presentation, George. That was really, really interesting and a great overview. I was just going to ask if you can pass over your host abilities to Hannah, because I think Hannah has some slides, and I tried to give her hosting abilities, but I realized you've got the magic wand.
So if you just how I can do it.
Yeah. So if you've got Hannah here, you just click on the 3 dots by Hannah, and you should be able to promote her to host.
What an innovation.
Oh, I'm promoting you to host.
Hannah Simon is now host.
Oh, I'm now host. Okay, lovely.
Yeah.
So
I'll pass over to you, Hannah, now to do a presentation to chat through some of the practicalities of being prescribed cannabis.
can everyone see? I think there's probably a bit too many people. Right, okay, let me just reduce this. Oh, no, let me just get rid of that. Okay. Sorry, this is not reducing. There we go. Okay, so firstly, thank you very, very much for letting me join this panel. And I'm going to tell you a little bit about how to access medical cannabis using the Script Assist platform, which Dr. Eralil referred to just now. Just a bit of background on me. So my background was quite corporate. So I spent 15 years at Morgan Stanley, followed by Ernst & Young, hating my career, if I'm honest, in the corporate world as a management consultant, specialising in healthcare, and did a lot of work in the NHS. A lot of work with children's hospitals. That was kind of what I was known for, and then entered the medical cannabis sector prior to legalization, August 2018. And actually, I was triggered by the stories of the pediatric epilepsy patients and their parents that were in the news around June of 2018. I have to say, this is my first experience of speaking to a group of people suffering from trigeminal neuralgia, and just hearing Teri's story and understanding more about it. It just sounds very awful, and this is something that I'm quite passionate about. So I originally joined the cannabis space, setting up the first medical cannabis clinic in the UK back in 2018, and then joined Scriptus in November 2020 as a COO. Scriptus is licensed by the MHRA and Home Office, so we take regulations quite seriously. So if anybody has any questions on the regulations, please do ask, because as Dr. Eralil said, it is very tightly regulated. But once you understand them, they can make a bit more sense. Generally, as an organisation and me as a person, I'm quite committed to integrating medical cannabis into existing private clinical pathways rather than through the cannabis clinic model, just to ensure maximum patient access. The 35,000 or so patients today who are accessing it, some of them through cannabis clinics, it's a different journey. And for me, the only way cannabis can really be accepted and really reduce that stigma is if a doctor who sees their patient knows to suggest it and can prescribe it then and there, and doesn't feel that they need to refer that patient out of their pathway to someone else. And really, it just needs to be part of a holistic care package. So I just wanted to just clarify what we mean by medical cannabis, because there are licensed cannabis-based medicines and there are unlicensed cannabis-based medicines. And I just want to touch on this very, very quickly. So licensed medicines refers to products that have been granted marketing authorizations by the MHRA or the EMA. Those products have gone through rigorous clinical trials, multiple phases, phase 0, 1, 2, 3, 4. And the objective of those phases is really to ascertain efficacy and to be able to make the claim this product is good at treating this particular indication. So you'll see on Calpol, you'll see on Nurofen, you'll see on all these kind of medicines that you're familiar with that there are kind of marketing assertions. Once a product is licensed, then it, in some instances, it can be prescribed as a first-line treatment. It can then be assessed by NICE on cost reimbursement, and eventually it can be free on the NHS. So there are some licensed cannabis-based medicines, such as Sativex, Epidiolex, and Nabilone. So they may have on your radar, but I just kind of wanted to be clear as to what those are. The products that we're talking about today, they are the unlicensed CBPMs. So these refer to products that fall under the definition of a cannabis-based product, but have not undergone these rigorous clinical trials for various reasons, some of which that Dr. Eralil referred to, the fact that the 147 plus endocannabinoids and how to isolate various components and all the different components of it and how to isolate those variables. But therefore, because they've not undergone those clinical trials, they cannot make the claim that this product is good for this indication, and therefore it is categorized as an unlicensed medicine. Now, unlicensed cannabis-based medicines are treated usually as follows. So they are still authorized for importation by the MHRA, but only when there is proof of patient need and it is confirmed that it is manufactured and imported as a medicine. That is different to street cannabis, okay? Street cannabis is, well, out of those 147 cannabinoids, you don't really know how much you're taking of any of it. You might go to your dealer and one batch will be good and one batch won't be good, and you don't really know if you're getting stunk or you don't know what strain you're getting, and there's kind of a lot of uncertainty. And also, as we just heard, there are some horrible stories of dealing with street cannabis dealers. So I just wanted to make clear that medical cannabis is produced as a medicine, and therefore there is stability and there are certificates that come with that. It can only be prescribed by a specialist consultant and as a drug of last resort. So as Dr. Eralil said, that's often interpreted as trying 2 licensed medicines or therapies. But it can be, to be honest, it's the doctor's discretion. I mean, it's one of those things that as a patient, it's a conversation between you and your doctor as to whether it's appropriate, but it must be a drug of last resort and cannot be a first-line treatment. As such, it is not free on the NHS, and because it's not gone through those clinical trials and because it's not been able to say this is good for this treatment and all those barriers, that's why it's prescribed in the private sector. And I kind of wanted to be honest and clear with you from the start that this is a paid for medication. I can see that one of the questions has already been about cost, and we can come on to that. But I just wanted to be clear that these are the products that we are discussing today. Who are we? What is Script Assist? So Script Assist is a digital platform that streamlines medical cannabis prescribing, connecting patients to doctors and connecting doctors to trainers and a whole bunch of other stuff that keeps them aligned to GMC regulations and NICE, and everything's in one app. So our Find a Doctor feature is the UK's only directory of private specialists, independent doctors who are able and willing to prescribe medical cannabis as part of their standard clinical care, such as Dr. Eralil. We have a couple of doctors who prescribe for facial pain, but none quite as esteemed as himself. So we're thrilled to have him on the platform. We provide a range of support services to both doctors and patients who are interested in learning more, understanding that there is a stigma and there is uncertainty and there are questions, and that's what we're here for. It can be a bit of a leap of faith, and we really provide a lot of support in order for both doctors and patients to kind of start their journey. Also, as with any medicine, medical cannabis is not suitable for any and everyone. Like, I don't want you to think that's what I'm saying or anyone is really saying. It's important for patients to be offered it though as an option, because it could really help them. And where other treatments have failed, it's important that patients are made aware of this as an optional treatment plan. And like I say, not to be then referred elsewhere for someone else to prescribe it, because you build that relationship with your doctor. That's why we don't pay doctors to prescribe it, and there's no obligation for patients to try it. I mean, it's a conversation between a patient and their doctor, as with any other medicine in the private sector or even in the NHS. Like, these are conversations that happen in a clinical setting. And yes, I just want to say we're delighted to be able to now extend our service for patients suffering from trigeminal neuralgia. We obviously serve the patient community, chronic pain, psychiatry, epilepsy, but this is I think you would term it an orphan indication. It's a small but important cohort of which there aren't many licensed therapies to try. So this is an area that I'm really interested in. Finally, kind of just how to access medical cannabis using Script Assist. So, like I said, it's all on a digital platform. It's all on an app. You've got kind of the QR code to download the Script Assist app today, and there are various things that the app enables you to do. So, as Dr. Eralil mentioned, you fill out an eligibility questionnaire, and these are some sort of basic questions about your current situation, about how many licensed therapies you tried, if you've been diagnosed with trigeminal neuralgia, if you are happy with a GP being informed. There are various kind of questions that kind of help you on your journey. Then we have redirect you to your Find a Doctor app, which is where you can find a doctor for your specific indication area, and you can book a consultation, you can engage with that doctor. You can then use it to join telehealth, you can join the consultation through the app, and then you can track, if you receive a prescription, you can track it a bit like Amazon. You can track exactly where your prescription is in the journey. And because of the regulations, there are a number of steps as part of the regulations. So, for example, doctors can only be dispensed on the receipt of a wet signature. So what that means is the pharmacist has to receive the physical prescription, which is only true of private controlled drugs such as cannabis. So you can see when it's arrived at the pharmacy, you can see when a multidisciplinary team has reviewed it, you can see everything through the app. You can also monitor your symptoms through the app. So there are quite a few symptom monitoring apps, and this is kind of one of the things that we wanted to bring into it, because it's quite important for patients to feel that they are in control of their symptoms, and also for doctors to see that it's working. And if it's not working, then you can come off it. I mean, this is just a way for you to view all of that, and then you can request a repeat in a kind of simple one click. That's basically it in a nutshell. As I said, you can look more on our website, or feel free to email me at info@scriptassist.co.uk. I will, of course, make myself available, and we will respond to you. And that's basically it. And now I'm going to stop sharing.
Thank you, Hannah. Yeah, that was super comprehensive, and yeah, a really nice summary of Script Assist. So yeah, there's a bunch of questions that I'll move into the Q&A now, but yeah, if anyone has any specific questions around Script Assist and just the practicalities of prescribing, do ask, or yeah, you're welcome to contact Hannah on email as well. But yeah, I'm aware we have about 9 minutes, and I promise we will finish on time as promised. So yeah, I'll move straight into some questions. I think most of these are directed at you, Teri. So I've got quite a lot of questions for you, if that's okay.
Yeah.
So I'll just start from the top. An anonymous attendees asked, how does medical cannabis compare to other medications that you have or have not helped, and kind of how does that compare? And they also say thank you for sharing.
You're welcome. Okay, so oxcarbamazepine was probably the most effective medication for a very, very long time. But then all of a sudden I started like almost losing memory. I'd get to the fridge and I didn't know what the fridge was. I actually stood there and just burst out crying and was like, and my husband came in and was like, what's the matter? And I'm like, what is this? What is it? And yeah, these things happened quite a lot with certain medications. And like I said, I had hives with some, heart palpitations with another. I've been through a lot of medications since 2015. I've tried everything, and for long periods of time as well. With the cannabis, the only and literally the only side effect that I have is with the sativa, which is during the day. If I take too much, I feel like I've drunk too many coffees. I just get a bit wired. That is literally, for me, that is the only side effect. So yeah, it's like unbelievable considering the side effects of other medications.
Yeah, definitely. Absolutely. I think I've got another question from another anonymous attendee. And I think I'm not sure who's best placed to answer this. Maybe Teri, maybe George, or even Aneeta. There's a question around, in the case of TN from shingles, how long would you normally be prescribed cannabinoids? Quite a specific question. Don't know if anyone has the answer. No. Yeah, George, go for it.
So there doesn't have to be a limit to how long you can be prescribed the cannabinoids for. But firstly, it has to come from an appropriate person. So so for example, I can't prescribe you medicinal cannabis for shingles because I don't, as a neurosurgeon, I don't see and treat shingles in my usual practice. So it has to be a condition that is seen by a specialist routinely in their practice, and that's the United Kingdom law. So your best option would be to try and find a neurologist who deals with shingles and post-herpetic pain or post-shingles pain, who is also in the medicinal cannabis world. And there are a few. Most clinics have at least one or two neurologists attached to them. Be mindful, though, that a lot depends on how you actually take the cannabis, and there's always going to be a trial and error period because the golden rule is, we start low and go slow, because you don't want to be hit with high THC levels and CBD levels and then things not really working for you.
Cool, thank you. I'm going to combine some of the questions because I'm seeing some common threads. So one of the questions that's coming up is around cost. So I'll kind of rattle through some of the questions and then pass over to the panel. So there's definitely a question around how much a prescription costs. And then there's quite a common thread of questions around interactions and whether you can take medical cannabis with other medications, for example, sertraline, pregabalin, and yeah, just other medications in general. So yeah, I'm not sure who would like to take the cost question, whether like Hannah or Teri, and then yeah, I think George, you'd be well placed to answer the question around interactions. So Hannah, go for it.
I would say probably both. I think probably everyone's interested in hearing how much Teri spends, and I can tell you kind of a bit more generally. But I can say that generally we would say a medical cannabis patient can expect to spend between about 100 and 150 to 250 pounds a month. That depends. Is that about right, Teri?
Yeah, that's about right. £50 for consultation, continuing consultations, and then be between 150, 100, 150. Sometimes it can be more, depending on how many different varieties you're purchasing, I suppose.
Yeah. So the oils. So if you were to be prescribed an oil, and this would probably be a question for Dr. Eralil. If you're prescribed oil for a month in a 30ml bottle, that can be about 120 pounds. If you're prescribed flour on top of that, then that for breakthrough or for whatever reason, then that can obviously add to it. But it depends on what is appropriate for you and your particular symptoms.
Yeah, definitely. And George, would you like to answer some of the questions around interactions and using other drugs?
Yes. So as I said, the most effective way of getting the benefits of medicinal cannabis is vaping it. Surprisingly enough, because it's clean and it's temperature controlled, and it doesn't, at 217, 220 degrees, all the terpenes just evaporate. So you can't burn it. If you burn it, there's no use. And remember, it's also it's the female flower of it's the bud that actually has the most amount of cannabinoids in it. Not the leaf, not the stem, not anything else. It's the bud. So interactions. Well, at the levels of CBD and THC you will be taking or vaping in, interactions are very, very uncommon. And I think there are drugs in the body that go through first-pass metabolism in the liver, for example. So, several drugs go through it, especially carbamazepine, oxcarbazepine. They all go through liver metabolism. And therefore, anything that goes through your digestive system will also go through that first-pass metabolism. That's the only way that they can interact. And that's so cannabis as a capsule or a pill is pretty ineffective, because the science behind trying to preserve that cannabinoid function throughout that metabolic pathway is quite challenging. The oil, on the other hand, is sublingual, which means it's just underneath your tongue, so it can be absorbed directly into your bloodstream. But then that has other problems, So the oil can be very yogurty tasting. It can have very, these are several stories that patients have mentioned. So the oil has a flavor and a smell too. The vape has a smell. So, so interactions are very, very uncommon. Toxic doses. Now, there is no lethal dose for CBD or, cannabidiol, but there is a toxic dose for THC. If you take too much THC, you can run into many, many problems, anxiety states, extreme high blood pressures, heart attacks. Whereas CBD, there's not really any lethal dose for it. While CBD acts for pain perception, THC will act for relaxation types. It's all about a balance when these prescriptions are being done. And the most popular products are the vape and oils. And for most cannabis naive people, oils are a fantastic way to start off, because at least it'll test your system and how you feel during the day.
Yeah, and I guess it's always best just to consult a clinician around interactions and your specific circumstances. I'm aware we're running out of time, or have run out of time. I just wanted to quickly pass over to Aneeta just to give a little bit of information around membership to the TNA and how they support patients. I'm aware we've got a few questions, but I think they've largely been answered, and where we're out of time. But yeah, Aneeta, if you'd like to just quickly say a few words.
Thank you very much indeed, everyone, for such an amazing panel discussion and the really interesting questions. But if anyone is suffering from TN, and I can see some of our members online that I recognise their names, you can join the TNA Association, tna.org.uk, and if you're struggling to find the membership, we'll pay that for you. It's only a small amount. It's £20 a year. We do fund memberships for those that can't afford it. Teri, I'd be very happy to gift you membership, and that gives you telephone support help, it gives you regional meetings, it gives you national webinars where you get amazing experts like George, that is so overdue to come back and speak to us, online, and a members area, and there's booklets and other information. So, and there's a community, and we are honestly like a family that are there to help and support. So if anyone needs any help, we're really will be delighted to help anybody that needs it. Don't do this on your own. You know, you've got amazing clinicians here, you've got great people, but you don't have to do this on your own when there's a whole load of people here to help and support you.
Cool, thank you. Well, yeah, participants, if you haven't been familiar with the TNA and you're interested in joining, definitely check them out. And yeah, I hope this evening's been really interesting. I hope you've learned something new around medical cannabis, and yeah, some questions and concerns have been alleviated. But yeah, if you'd like to find out more, I know Hannah and Dr. Eralil, they provided their contact details around finding out a little bit more. So yeah, please feel free to get in touch. Hope you enjoyed the webinar, and yeah, have a nice evening. Thank you for taking the time out.
Thank you.
Cool.
Thank you.
Bye. Bye, everyone.